Hello, my name is Madison Ward. Today I'm doing the Patient Care Encounter Reflection assignment for COH 100, and I'm going to be kind of elaborating further on somebody that I already interviewed for the past assignment where you had to write an essay about their health care encounters. And so I'm going to be reflecting on my friend Renee today, and I talked with her again just to make sure I got all the details correct, especially for this assignment. And just a short overview of what happened is she ended up getting a UTI and then taking over the counter UTI medicines for that, hoping it would solve them because she said previously in the past it had worked for her. And then eventually her back started hurting really bad, like her lower back. And so she knew that that was maybe a sign of a kidney infection. Also, she said the UTI didn't really improve at all whatsoever with the over the counter medicines. And so she ended up going to urgent care in her hometown of Crown Point, Indiana. And she said when she was there, she had to wait almost an hour to get seen, which, is usually kind of typical for urgent cares, as unfortunate as it is. But she said when she was there, she had to give a urine sample. She waited another 35 minutes for a doctor to come see her about that urine sample. And initially, it was a nurse that was coming and seeing her, took her vitals, stuff like that. And then the doctor came in with the results from the urine sample and said, yes, you do have a kidney infection, as well as the UTI, but there was blood in her urine, so they were able to tell that she had that kidney infection. And they ended up prescribing her UTI antibiotics instead of antibiotics that are typically used for a kidney infection. So she took those antibiotics, but they didn't work for the kidney infection. They weren't strong enough, I'm assuming, but she ended up having to go into the emergency room a week later because of that. And she's kind of always seen that as a mistake on their part, and after hearing her story, I don't know exactly what the procedures are for physicians or nurses when they are prescribing those types of medicines, but it does definitely sound maybe like a mistake on their part, I would agree. So the two healthcare professionals that were involved in her situation would have been that nurse and then the doctor, both of which she had seen for less than 10 minutes in total. Most of her time was spent waiting. um, Personally, after hearing that, I think that it would have been beneficial for maybe the doctor and the nurse to be in the room together so that they could collaborate and speak about Renee's situation, just in case there was, information given to the nurse that wasn't communicated correctly to the doctor and so forth. And I think that maybe that's where the mix up about the antibiotics might have been involved. So I don't know if there was necessarily a need for another healthcare professional to be within that situation. I really think for something as simple as a UTI or a kidney infection, the nurse and then the doctor was probably just appropriate. But like I said, it would have probably been beneficial if they were in the room at the same time. Um, kind of just to elaborate more, I don't think that they work together well. She doesn't seem to think so either, especially due to the fact that she kind of emphasized a lot on having to wait and then not just being informed about what the doctor was doing. She said that the nurse told her she'd only be waiting about 10 minutes for the doctor, when in reality, like I stated previously, it took about 10 to 15 minutes. As for any other type of professionals to be involved in that situation, I honestly don't think so. That doesn't seem like a situation in which another professional would need to be in. When I hear that, I kind of think that maybe, say, given an example where a child was injured and there might be suspicions of abuse, then you would need probably a CPS. But considering how Renee's situation was absolutely nothing like that, I don't think the need for any other kind of health professional was necessary. If anything, I'm not exactly sure what the doctor is that specializes with kidneys or anything like that, but if anything, maybe she could have been referred to one of those type of doctors and actually gone to the hospital for a night stay or two before it got to the point where she was needed to go to the emergency room. That might have been good. It probably would have eliminated the issue a lot simpler and a lot further without her having to go to the emergency room at all. Other than that, there was definitely a couple mistakes or room for improvement, if not mistakes, that I think that they could have done, and I would hope that those physicians or caregivers have learned from that experience and they continue to provide quality care for the rest of the people who come in with situations as such. Thank you.